Good morning, friends. I am Dr. Chockalingam, Medical Director, Vignesh Venu Eye Clinic, Chennai. Today, I am going to talk about something, a disorder which is very common and perhaps troubling all of us. The condition I am going to talk about is dry eyes. Dry eye was a condition which was not known till about 2 decades back. With the advent of computers and increased use of software, many people have this problem. This problem has become a day-to-day affair for almost all of us today because of our change in the lifestyle. Today, most of us have been constrained to sit in the house due to the pandemic, and increasingly, many of us are spending more time on the computer screen or working on the laptop, tab, or mobile. Therefore, dryness of the eye has become a very common condition, something like headache. Now, why does our eyes become dry? That's because when we work on the computer or a mobile, we just do not blink frequently. The purpose of blinking is twofold. One, to keep the eye wet and moist, just like how a wiper in the car works, and another is to prevent anything from falling inside the eye. Normally, we blink around 12 to 15 times a minute. But when we work on the system, because we have to look at the monitor all the time and we cannot move elsewhere, we can even take our hands off the keyboard and work, but we cannot look elsewhere and work on the computer. And therefore, we don't blink frequently. It has been found that people blink only 4 to 6 times a minute. So when we don't blink, the eye becomes dry because the blinking moistens the eye surface evenly. This gets aggravated when we work in an air-conditioned environment, which is what most of the software engineers do. Because in an air-conditioned room, the humidity is less. Whenever the humidity is less, evaporation is greater than perspiration, and therefore the tear film gets evaporated fast. And when we work indoors for a very long period of time on the mobile or the laptop, eyes become dry. That is why dry eye, which was hitherto seen in people spending long time on the computer as a part of their profession, today we see it virtually in everybody, including school children, because of the online classes which have been happening for the last 2 years. So dry eye has become a very common problem seen in almost everybody to a lesser or a greater extent. So what are the symptoms of dry eyes? The patient doesn't come to the ophthalmologist saying that they have dryness of the eye. They come with certain symptoms like irritation, watering, pin pricking sensation, tiredness, fatigue, and sometimes eye turning red towards the end of the day. Now, all these symptoms may be there, or a few symptoms may be there. And then we have to look into their work history, the number of hours they spend on the system. So, dry eye is often diagnosed by eliciting symptoms from the patients. Apart from this, the severity of the dryness can be assessed by doing few simple tests in the clinic itself. There are a few tests which determine how much tears is produced in the eye. The main reason for dryness of the eye in people who work on the computer for a long time is reduced blink rate and thereby increased evaporation of tears. Once we diagnose a condition, we have to get into the treatment. So, how do we treat dry eyes? The first step in the management of dry eye is advising certain lifestyle modifications to the person. The best solution will be to throw away the computer or the laptop, which none of us can do. These gadgets have become a part and parcel of our life. So, what do we do? The first thing is, whenever we work on these gadgets, it's advisable to take a short break once in a while. Just get out of the system, go around, have a cup of coffee, say hi to somebody, come back and do your work. In that intermittent time, you will start blinking on your own. If we look in the website, there is something known as 20-20-20 rule. That is, every 20 minutes, look at 20 feet distance and blink 20 times. Now, let me tell you, this does not work because any activity which happens subconsciously in your body, if you do it consciously, it is going to be uncomfortable and painful. Imagine we are conscious of our breathing or our heart beating. It will be uncomfortable. So nobody can forcefully or consciously blink. Blinking is something which should happen subconsciously. So this 20-20-20 rule is good to hear, but it is impractical. So the best solution is to get out of the system, go around, have a cup of coffee, say hi to somebody, come and start working. The second thing is, the computer should be at the level of your head or little below. It should not be at a higher level, because if the screen is at a higher level, you are going to keep your eyes more widely open, greater surface area of exposure, greater chances of dryness. The third modification is, if there is a single air conditioner unit, make sure the AC unit doesn't blow directly onto your face. You should position your work desk accordingly, because if the AC is going to blow directly onto your face, the eyes will become dry very soon. The next modification would be when you drive vehicles. If you are driving a two-wheeler, wear helmet, visor, or some cooling glass, or plain glasses, or your own glasses if you have refractive error, so that the eyes don't become dry too fast because of the wind blowing onto your face. And if you travel in the car, make sure the AC vent doesn't blow directly onto your face. When you sleep in the night, again ensure the AC doesn't blow directly onto your face, because when we sleep in the night, our eyes may not be tightly closed all the time, they may be snugly open. And when they are snugly open, the eyes can become dry in the night, and many people say that they have a stuffy feeling in the eyes when they get up in the morning. They're not able to open the eyes. There's some puffiness and stuffy feeling. This is because of dryness happening in the night also. Some people occasionally wash their eyes with water and they feel better. But again, this is a misconception. That's because the tear film which is present in our eye has got alkaline pH, and water is a neutral pH, as all of us know. So when we wash our eyes with water, initially we have a soothing sensation, but later the irritation and redness increases because of the dilution of the tear film. These lifestyle modifications, practiced to a lesser or a greater extent, reduces the symptoms of dryness to a significant level. Apart from this, the doctor will prescribe certain medications which are basically lubricating eye drops, which we will be advised to apply depending upon the degree of dryness. These drops, once a vial is opened, can be used up to 4 weeks, and these drops essentially do not have any side effects even if they are applied in the long run. Majority of the people with these lifestyle modifications and simple lubricating eye drops and gels will notice definite improvement in their condition. All said and done, this is a lifestyle disorder which requires lifestyle modification and application of certain eye drops. Some people may have dryness of the eye due to decreased tear production. Now, this is an extremely small group of people who have certain systemic diseases like hypothyroidism, arthritis, and some diseases called as connective tissue disorders. In these situations, again, the nature of dryness, the cause for the dryness, and the severity of the condition can be best assessed by the ophthalmologist, and suitable medications which are available to treat these conditions are often prescribed. Apart from this, certain higher levels of treatment are also available to treat dry eyes, but in majority of the people, as I've told now, simple lifestyle modification and medications such as lubricating eye drops will do. But the most important thing is we have to cut down the usage of computers, laptop, mobile, especially mobile, as much as possible, and use them only when necessary. And if I have to use a word, we should not get addicted to mobile. Now, watching a mobile is different from reading a book. When we read a book, the eye moves. There is a gaze movement of the eye. And when we read a book, we flip the page after we finish reading one page. And when we flip the page, we blink inadvertently. So we do blink frequently when we read a book. Whereas when you work on the mobile, you can look at the mobile for hours together even without blinking. Therefore, excessive usage of mobile has many side effects. It disturbs the sleep pattern. There are many more side effects. Of course, it has become a necessary evil. All of us have to use mobile, laptop, tab. But I think the best advice would be to use it only when it is necessary. And remember, dryness is going to increase with aging. Many people commonly complain of dryness in old age. This condition is more common in women than men because of the postmenopausal hormone changes which take place in them. And dryness is becoming a very, very common condition. Therefore, I feel that whatever I've shared with you will help each and every one of you to understand the problem first and follow some simple modifications in your lifestyle which will ameliorate the problem to a great extent.